This presentation will review the image analysis of the ribs. Let's start with our AP or PA projection. Image analysis guidelines for the ribs state that the thoracic vertebra to the rib head articulations are demonstrated. The medial clavicular end is adjacent to the lateral edge of the vertebral column. Distances from the spinous processes to the pedicles on each side, when seen, are equal. The jaw and scapula are outside the lung field. In the PA projection, bilateral projection, they're clearly demonstrated 1st through 9th ribs in their entirety, with the posterior portions lying above the diaphragm. Clearly demonstrated 1st through 7th anterior ribs from both sides in their entirety above the diaphragm. In the AP projection, you want to see clearly demonstrated 1st through 10th posterior ribs from both sides, demonstrated in their entirety for ribs above the diaphragm. For ribs below the diaphragm, you want to see the 8th through 12th posterior ribs on both sides in their entirety. For a unilateral examination, the ribs for the opposite side may not be visualized entirely. Here is a slide with the image analysis guidelines we just reviewed. This image here just demonstrates adequate positioning for an AP or PA projection of the ribs. So let's talk about rotation. When in an AP projection, rotation is identified when the side of the chest closer to the IR demonstrates the medial clavicular end situated away from the lateral edge of the vertebral column. And it demonstrates a greater distance from the spinous processes to that side's pedicles when compared to the opposite side. So, a couple things here. When you're doing an AP projection, you should look at your sternoclavicular ends. If they are not in alignment with the vertebral column, you have some type of rotation. In an AP projection, your sternoclavicular end will be situated away from the lateral edge of the vertebral column, demonstrating that that side is positioned closer to the IR. In a PA projection, rotation is demonstrated when the side of the chest positioned to the IR, closer to the IR, demonstrates the medial clavicular end that is superimposed by the vertebral column and demonstrates less distance from the spinous processes to that side's pedicles when compared to the opposite side. Again, look at those sternoclavicular ends and see if they're in alignment with your vertebral column. Let's move on to our practice analysis. In this PA rib practice analysis, let's take a look at this. Obviously, this is supposed to be an image of the lower ribs. I will say they could have collimated and did a little bit better two-part IR. But this is more about positioning, so let's talk about the positioning. In a PA projection, there should be no elongation of the ribs, and the spinous processes should be demonstrated down the middle of the vertebral column, and we do not have that. So to me, this patient is rotated towards the right side. We need to rotate that patient's left side until that mid-coronal plane is parallel with the IR to obtain an appropriate PA projection of the ribs. Let's move on to our AP oblique projection of the ribs. Image analysis guidelines for the AP oblique projection state that the inferior sternal body should be located halfway between the vertebral column and the lateral rib surface. The axillary ribs are demonstrated with out for shortening and are located in the center of the exposure field. The anterior ribs are located at the lateral edge. For ribs above the diaphragm, the 1st through 10th ribs of the affected side and thoracic vertebral column are included within the exposure field. The 7th axillary rib is at the center of the exposure field. For ribs below the diaphragm, the 8th through 12th ribs are visible below the diaphragm. Part of the thoracic and lumbar vertebral column and 8th through 12th axillary ribs of the affected side of the patient are to be included within the exposure field. Here you will see the adequately positioned AP oblique projection of the ribs. And I have provided for you the image analysis guidelines. So let's talk about insufficient chest and rib obliquity. Because the sternum rotates towards the affected axillary ribs when the chest is accurately rotated for an AP projection, AP oblique projection, the position of the sternum can be used to identify the accuracy of the chest rotation and openness, per se, of the axillary ribs. If the sternum is positioned halfway between the vertebral column and the anterior ribs, the chest was rotated adequately at a 45-degree angle, and those axillary ribs are demonstrated as open. However, if the sternum, as in this image, is demonstrated next to the vertebral column, the chest was insufficiently rotated and the axillary ribs are foreshortened. So in looking at this image here, we can see that the sternum is in an insufficient area. It should be more midline down here rather than the manubrium and sternum over here next to the vertebral column. When talking about excessive chest obliquity, the sternum will be demonstrated lateral to the midpoint of the vertebral column and anterior ribs. So there'll be an over rotation. And you can see here, trying to find that sternal end, it's like a jumbled up mess. We are excessively oblique here. So we would need to bring that patient back into that 45-degree angle to adequately place the anatomy and to open up those ribs. So let's look at a rib practice analysis. This is an AP oblique analysis. As you can see, the inferior sternal body is actually demonstrated next to the vertebral column. So therefore, we should start thinking insufficient rotation. The chest was not rotated enough, and the 8th and most of the 9th posterior rib is seen above the diaphragm. The exam was not obtained on a full expiration. Sorry. In order to correct this, we definitely want to take the exposure on expiration, and we want to increase that degree of obliquity to 45-degree angle. In this next practice analysis, I believe the right axillary ribs were meant to be imaged. Otherwise, they clipped the left side, so that would definitely be a repeat. They're a little bit in a no man's land, so excuse the image, but this is the best I have today. But the point is positioning. So when you look at this image, if we were to take a projection of a AP oblique rib projection of the right ribs, the patient should be rotated in an RPO projection. This patient, however, is rotated in a LPO projection and would clearly demonstrate the left ribs as opposed to the right ribs. Therefore, we need to rotate that patient towards the IR until that mid-coronal plane is angled with the 45 degrees with the IR for the side of interest, which is the right side. This concludes our rib analysis. If there are any questions, concerns, please feel free to email me and or contact me while I'm out at clinic so we can review anything that you may have questions about. Thank you for participating in the image analysis.